Death is a topic most people try to avoid discussing. However, understanding the signs that may indicate the body is preparing to shut down can help individuals and their families prepare emotionally and practically. While no one can predict the exact moment of death, doctors and palliative care specialists have identified certain physical and psychological signs that often appear in the final weeks or days of life, especially in seniors. In this article, we will explore 5 major signs that may suggest death is near. These signs might appear gradually or suddenly, and while they can be alarming, they are also part of the natural process of dying. Knowing about them can make the journey more peaceful for both the person and their loved ones. One of the earliest and most common signs that the body is nearing the end of life is severe fatigue. Unlike ordinary tiredness that can be resolved with rest, this type of fatigue is profound and persistent. Seniors may find themselves unable to get out of bed, participate in daily activities, or even stay awake for extended periods. As the body begins to slow down, organs work less efficiently, and metabolism decreases dramatically. The body conserves energy for only the most basic functions, leading to overwhelming weakness. You might notice them sleeping much more than usual, sometimes 18 to 20 hours a day, having difficulty staying awake even during conversations, losing interest in activities they used to enjoy, and needing help to sit up or move. Support the person by creating a comfortable, resting environment. Avoid forcing them to stay awake or engage in activities if they don't want to. Listen to their needs and let them rest as much as they wish. Changes in breathing patterns are among the most noticeable signs of approaching death. Doctors refer to this as Cheyne-Stokes breathing, a pattern where breathing becomes irregular, often alternating between deep, rapid breaths and periods of no-breathing apnea. The brain's respiratory center starts to fail as the body weakens. The buildup of waste products in the body can also affect breathing. You might see periods of rapid, shallow breathing followed by long pauses. Gurgling or rattling sounds, sometimes called the death rattle, caused by the accumulation of fluids. Breathing becoming more labored or gasping, and changes in skin color, especially bluish or purplish tints in the hands and feet, indicating poor oxygenation. Elevate the head with pillows to help ease breathing. The gurgling sound is distressing. Repositioning the person can help reduce it. Avoid suctioning, which can be uncomfortable and is rarely necessary. Talk to healthcare providers about medications that can reduce secretions and ease breathing. Another major sign is a dramatic decrease in appetite. Seniors may stop eating and drinking altogether as the end approaches. This change is natural and does not necessarily indicate suffering. The body no longer needs as much energy. Digestive functions slow down and the sense of hunger or thirst diminishes. Forcing food or fluids can lead to discomfort and complications such as choking. You might notice refusal to eat or drink, difficulty swallowing, weight loss and muscle wasting, dry mouth or thickened saliva. Offer ice chips or small sips of water if they wish. Use a moist swab to keep the mouth comfortable. Respect their wishes if they refuse food or drink. Remember, this is a natural part of the dying process. Mental confusion, restlessness, and withdrawal from social interactions are also common signs. Seniors may appear disoriented. Talk to people who are not there or express a desire to go home, even if they are physically at home. Decreased oxygen to the brain, metabolic imbalances, and medications can cause confusion. Spiritually, some people believe this stage represents a transition between life and death. You might see difficulty recognizing loved ones, conversations that do not make sense, agitation or sudden bursts of energy followed by deep lethargy, and withdrawal from visitors, preferring solitude. Provide reassurance with gentle touch and calm words. Avoid arguing or trying to reorient them aggressively. Dim lights and reduce noise to create a peaceful environment. Near the end of life, blood circulation slows down, and the skin may change in appearance. Hands and feet may feel cold, and the skin may appear mottled, patchy, and discolored. As the heart becomes less efficient, blood is diverted to vital organs and extremities receive less circulation. You might notice cool, bluish, or purple discoloration in the fingers, toes, and lips. Skin mottling, especially on the legs and arms. Reduced or absent pulse in the extremities. And a weak or irregular heartbeat. Keep the person warm with light blankets, but avoid heavy layers that may cause discomfort. Gently massage hands and feet if it feels soothing. Understand that these changes are natural and do not necessarily cause pain. Beyond physical signs, many seniors experience emotional and spiritual transition. Some may express fear, regret, or anxiety, while others may show acceptance or even eagerness to move on. Listen without judgment. Encourage them to share their feelings. Offer comfort through prayer, music, or rituals that are meaningful to them. Sometimes, simply being present is the greatest gift you can give. While these signs usually suggest that death is near, it's important to keep in touch with healthcare professionals. Pain management, controlling shortness of breath, and ensuring comfort are priorities. Call for help if there is uncontrolled pain or distress, sudden, severe. Bleeding occurs, the person shows signs of severe anxiety or panic, or you are unsure about how to handle changes. Palliative care or hospice teams specialize in supporting both patients and families during this time and can provide crucial guidance. Understanding these signs can help loved ones prepare emotionally, resolve unfinished business, and say final goodbyes. It can also help ensure the dying person's wishes are respected regarding life support, interventions, and place of death, for example. At home versus hospital. Many families find comfort in planning memorial services, writing letters, or sharing stories while the person is still conscious. It can be a time of healing and closeness. While the topic of death is difficult, recognizing these 5 signs of fatigue, changes in breathing, loss of appetite, mental confusion, and changes in skin and circulation can help you understand that the body is preparing to let go. Being prepared doesn't make the loss any easier, but it can make it more meaningful and peaceful. Supporting your loved one with compassion, patience, and love is the most important role you can play. Remember, every person's journey is unique. Some may show all these signs while others may pass without obvious changes. Trust your instincts and seek professional support when needed. Facing the end of life is one of the most profound human experiences. By recognizing these signals, seniors and their families can spend the final days in a way that honors life and embraces the natural cycle of existence. Stay present, hold hands, share words of love, and above all, be kind to yourself in this process. Old is gold.